All right, so tell a little bit about the audience, how you got started in the community.
Well, let's see. I'm a mental health counselor in Seattle, but I work virtually. So I work with folks all over the state of Washington. And prior to the work I'm doing now in mental health counseling, I also worked in the nonprofit sector in kind of a similar field, but I did some education and some coaching. But in mental health counseling, I started really this process by applying for graduate school, going to a graduate school here in Seattle, and then doing my clinical practice here in Seattle as well.
Hmm. That's nice. So tell me a little bit about the work that you do in counseling. What's the data like? Because counseling, it's pretty broad.
hmm It is pretty broad, and there's a lot of different types and focuses of counseling. So, the specific kind of counseling I do, mental health counseling, I work with adult individuals who are dealing with a variety of challenges. So, anxiety, depression, specific phobias, life transitions, grief and loss, kind of the whole spectrum of what we as humans experience.
Hmm. So tell me, like what sorts of methods or approaches do you use in your kind of work, with when working with patients?
hmm So one of the tools or methods that I use most is something called eye movement desensitization and reprocessing, or EMDR for short.
What's that all about?
It's a pretty interesting technique or method that really it's all about kind of helping our brain give it what it needs in order to organize memories in a way that aren't so distressing. So typically, most of us have experienced something that causes distress in our life, and sometimes it has a bigger impact than other events. And those events can really stay with us and cause distress in the present. So, EMDR involves using bilateral stimulation, which means essentially moving from side to side. So, either eye movements, tapping, or sounds. And it really helps our brain access memories and also be kind of in the present moment. So, we want to keep one foot in the present, one foot in the past. And we go through a series of questions to help bring up memories from the past, maybe some emotions, some feelings, some beliefs about ourselves. And then using the bilateral stimulation, it can help our brain kind of make sense of and organize some of those memories from the past so that we can organize it in a way that doesn't cause distress in the present.
Mm, that's awesome. So I know I don't have this in my questions, but has there been
Mhm.
any research that sort of says that EMDR is effective at really,
Mhm.
helping people, recount memories and stuff like that?
Yeah, so there's actually a lot of research that says that this is effective. And actually, I believe the Veterans Administration and Department of Defense recognize EMDR as a best practice or gold standard for treating PTSD in combat veterans. And that's just one thing it can treat. So it's also just a really great, effective tool for addressing anxiety and depression and phobias too. Excuse me. And there's been a lot of research to show it's as effective as some pharmaceutical treatments to treat things like depression.
Hmm. So my next question is, what
Mhm,
have your patients, what have they said, when they come to you and ask for advice? What
mhm,
sort of feedback, if you will, have you gotten from
mhm,
patients, that come
mhm.
see you and ask for advice?
Well, it's interesting. So, counseling and therapy, people do come and ask for advice, but I think that the solutions we come up with ourselves are the ones that stick. So, people come in and maybe they want to know how to better manage anxiety. Um, I don't necessarily give advice and saying you should do this, this, and this, but I really want to be collaborative because I want to honor that every person is individual and unique. And I believe that the ideas and the solutions that people have within them are generally what works best for them. I just help them uncover their strengths, their abilities, their preferences, and maybe fill in some gaps, but give them missing information they didn't have before. And then they feel empowered to make choices that work best for them.
Mm-hmm. My next question is what impact does your work have on the greater community? Like how does
Mm,
counseling, as a counselor yourself, how has that,
mhm,
impacted your work? Is that
mhm,
rewarding, satisfying, and also kind of like what impact does counseling in general have on the greater community? How can this
mm.
be sort of an asset to people who are struggling?
Well, I believe that counseling and therapy and finding the right person to help, it is a huge asset to people who are struggling. I think often we struggle as humans because we feel alone, we feel isolated in our troubles and in our challenges. And when we can sit with someone to just listen, we realize we're not so alone. And I think um, in our community, mental health is so important. And I think it serves as a ripple effect because when an individual feels heard, when they feel seen, they might be able to act in ways, they might be able to feel empowered or feel better so that they treat the people around them maybe more kindly and with more respect. So I think if everyone focused and had the opportunity to connect with the right counselor, the right therapist, I feel that our communities would be stronger and healthier, more connected, more compassionate. And I feel that that serves the greater good.
Hmm. My last question and all is this is, like, what can other people in your position, what can upcoming, students, wanting to be
Mm-hmm,
like psychologists, how can they
mm-hmm,
sort of, find the tools that they need to, help
mm-hmm,
patients be seen and heard? Because that's,
mm-hmm,
that I think is important.
mm-hmm. I think that is the most important thing. And I think um, as a student, as maybe someone younger kind of coming up, or maybe someone who's considering going into the counseling, therapy, psychology field, I think being open and listening, learning, connecting with people, asking questions. I often say that curiosity and compassion are just two of the most important um, things we can really do, I think, as humans, as individuals, and in this field. So they can find tools. I think online, there's so much wonderful information out there. There's podcasts and YouTube videos to learn a little bit more about different types of therapy. There's a lot of clinicians that are open to connecting. I mean, I love mentoring and connecting with younger clinicians with students and helping them figure out what path they want to take because there are so many options in this field to be able to help and connect with others.
Yeah, I bet there are.
Mm-hmm.